We are in Florida, the state that raised all the alarms on COVID infections. They are seeing 1,500 people hospitalized per day. It's the highest rate in the United States. We see how children are another concern. 19% of these hospitalizations are children. And all is happening while the mask mandates are very lax in this state. Also, not many people is vaccinated like other places in the country.
I feel like people in Florida don't take it very seriously compared to elsewhere in terms of wearing masks, vaccines. Like, there's no mandates. DeSantis says you can't force anyone to wear masks, you can't force people to wear masks in school. So even like now with the Delta variant coming back,
So right now we are going in a new wave of cases in the United States, and basically driven by the southern states, and with the highest number of cases is Florida. What the hospitals are trying to do right now is they are working at full capacity. They are trying to build up capacity on top of what they have. How they do that, for example, in the hospitals that I work, one example would be, well, we have single rooms. Now we're going to have 2 patients in those rooms. We have to put another patient in that room. You have to start canceling, for example, surgeries that are not urgent. And what we are doing right now is bringing nurses from other states to work temporarily in Florida to deal with this kind of thing. That increases cost. So really it becomes a crisis where not only those who have COVID get affected, but also those who do not have COVID get affected. The problem that we have with that is we have a population that was immunized, and mostly that populations are the elderly. So what we have seen now, we are seeing now is a shift of cases towards the younger ages. And we are about to start school in Florida. And there is a whole controversy about, what to do with the schools, whether use masks or not using masks, etc. Obviously, a huge proportion of those kids, all younger than 12 years of age, they don't have a vaccine available for them that hasn't been approved. We understand that after more than a year of pandemic, people may be a little bit uncomfortable about using masks or sick of using masks. But the truth is that this virus is transmitted by air. So there are very few things that you can do to avoid transmission, especially with a variant that transmits very easily, very efficiently. So what can you do? You either increase ventilation in the places that you are, you decrease people in the places that you are, so there are not so many people and it's less easier to transmit, or you use your mask, or you use your vaccination. So people don't want to use the vaccine. People don't want to use the mask. Well, the result of that will be, well, you're going to get more transmission. It's extremely frustrating, for example, for us to see a lot of people, basically my whole ICU, full of people younger. I mean, we are not seeing the 80s, we are not seeing the 90s-year-old, we are seeing 30s, 20s, 40s years old person, very sick, probably dying. None of them got vaccination. And then we see, that in the politics, people are arguing, about the use of masks, which is shown to be an efficient way of avoiding transmission. So it's like, all the medical information which argues, or we support the use of masks, we support the use of vaccination, we support about the use of, or support the idea that the vaccines are secure, etc., or are safe, are being argued in the political level, and that's very frustrating.